Hi, my name is Madison and I'm going to demonstrate how to do an intradermal injection today. So first, we're going to gather up our supplies. We're going to need our 1 ml syringe, our vial of medication, a gauze pad, alcohol pad, and some clean gloves. So first we are going to perform hand hygiene. And we are going to establish the 6 rights of medication. So our right patient, right medication, right dose, right route, right time, and right documentation afterwards. So first we are going to check our MAR to make sure that we grab our right medication. So we now have our order of our 0.1 TB injection. So we're gonna grab our vial, and we're going to look it over to see if there's any cracks and if the expiration date is good. With a multi-use vial, you would you would put the date and the time that it was opened with your initials. So first we are going to open our gauze, or open our alcohol pad, and wipe on our top of our vial. We are going to we're going to inject our the same amount of air that we want into the dose, so 0.1 amount of air. Now we are going to uncap our needle and place it. We are then going to inject our air into our vial. Then we are going to pull the amount of medication that we need, and then we're going to tap out any air bubbles underneath the air bubble. We're going to eject it. And we're going to double check our dose. So we have a 0.1 ml. We're going to cap it with our one-handed technique and scoop it. Now we are going to go into our patient's room. If my needle was contaminated, I would take off the contaminated needle. Now we go into our patient's room. We have our patient do 2 identifiers, so usually full name and birth date. I'm going to explain the procedure to the patient, and then I'm going to recheck any allergies, and that's while I'm there. I'm going to position my patient, perform hand hygiene. I'm going to put on my procedure gloves. Okay, so first we're going to position our patient. And then we're going to take our alcohol prep pad, and then we're going to clean our spot, our injection site, in circular motions. Then we're going to discard. So now we're going to hold our syringe in between our thumb and our index finger. We're going to uncap our needle with the bevel up. We're going to have our skin nice and tight. We're going to inject just the top into the top layer of the skin, enough to where our bevel is all under the skin injected. Now we're going to inject our medication until we see a bevel or see our bump of fluid. And then we're gonna inject, or we're gonna pull our needle out. We're gonna discard our needle into the sharps container. If need be, I will dab it with gauze, not a Band-Aid. I will explain to the patient that we will check the injection site in 48 hours, and then I will document the procedure, and then I will, after I've removed my gloves, of course, discard my gloves, and then document what had happened.